So what we've got now is got this question here. This is a patient who is from Belfast who wants to have a tummy tuck and is inquiring because she wants to have a Skype consultation and is an inquiry along those lines. So I think the main inquiry is, do we do a Skype consultation? So the answer to that is yes, we do Skype consultations. We treat them and we charge them the same as a normal consultation because we just put them in the diary like a normal consultation. And also but we encourage you to come for a live consultation in person prior to having surgery. And that would not be charged because you'd have already paid, because you only ever pay for the first consultation. So yes, we do Skype consultations, but I always say to people who are in this country, or at least who are, who live local to here, to Birmingham, have surgery local to here, have surgery local to Birmingham. There's lots of good places to have surgery in Birmingham and the West Midlands, and you shouldn't have to travel to go to Manchester or London or wherever. You shouldn't have to travel to find a good surgeon, and it's good to go locally for lots of reasons. One, with regards to this sort of thing, the consultation, the follow-up, the aftercare. If you've got any little niggles or scars not quite right, it's just so much easier if the surgeon's down the road. If you do need a little bit of revision, dog ear, a little bump, lump, need a small revision, it's just so much easier if you don't have to go all the way to some faraway place. And all these things obviously are compounded if you go abroad, which is another story in itself. So I always say to people, look, have surgery close to home. So that works both ways. So if someone inquires from Belfast, say, look, there's loads of good surgeons in Belfast. Look at the BARPS register, BAAPS, the Plastic Surgery Association, or British Association of Aesthetic Plastic Surgeons, or BAPRAS, British Association of Plastic Reconstructive and Aesthetic Surgeons. They got registers of their surgeons, and you should be able to find a surgeon close to where you live, a fully trained plastic surgeon. Another dig there, not dig. Have I got my books? Yeah, I've written a book about that. Never Accept a Lift from Strangers, currently free on the Kindle store. So if you go to Kindle store and go to Never Accept a Lift from Strangers, you can get my book free on the Kindle until Tuesday the 7th. No. Oh. Tuesday the 7th. That's today. Oh God, is it till, or is it next Tuesday? It's free for a week. My God, is it just till today? Oh well, I'm not sure if it is free. Oh God, right. Oh well. Anyway, you might be still free. It was free for a week. 7th of August. That's awkward. Anyway, that's today. So anyway, so yes. So you must look for a fully trained plastic surgeon. Again, another question there. But look for a fully trained plastic surgeon. But you'll have lots near where you live, and I would encourage you to go near where you live. So if you're in Belfast, by all means, we'll do a Skype interview, a consultation. You can come to the clinic. You can have surgery, and I do surgery on people who live far away. Oh, look at that. We've got some questions coming in. We do surgery on people who live far away, but I always say them this. I say this to them. Say them this. God, can we edit that? Angela, you're absolutely spot on. I agree with you. The price does sway a lot of people to go abroad. Yes, it does. And I understand completely, because I've seen the prices of surgery when you go abroad, and it is a lot cheaper than this country. And so I can totally understand why people do it. And it will continue to be a big business, to be honest with you, because the prices will continue to be less than this country, and people will always go abroad for surgery. And the good thing about a lot of the cosmetic operations is they have got a relatively low complication rate. So a lot of people will be fine, and so they'll be fine. And so for a lot of people, it's okay. The problem comes if you have a problem. That's the problem. And there's a small minority of people who get problems, and I've seen big problems and I've seen small problems, and it's just a bit frustrating. I've seen quite a few people who've had like small problems. They've not been, to be honest with you, they've not been that bad, the problems they've had. Bit of wound breakdown, maybe superficial infections, maybe some asymmetries, things aren't quite right, but it really needs to be the surgeon sorting this out. And the surgeons in, I can't remember where they've been now, Dominican Republic or Prague or Cuba or, wherever. And that's the problem. But, and you've also got to ask yourself, why is it so much cheaper abroad? You know, is it because we're all greedy and making loads of money? Well, I shouldn't have said that because that's probably what you think it is, but it's not. It's because we have huge amount of money that we have. The hospitals have to spend a huge amount of money on the regulations to make sure the standards in the hospitals are as high as they can possibly be. We have to spend a huge amount of money on our indemnity. Another reason why plastic surgeons are penalized in a way, because we spend a lot more on indemnity than non-plastic surgeons. We are covered for £5-10 million. So you've got that cover. We have insurance, which then covers you if you have a problem. But that costs many, many thousands of pounds. And other non-trained doctors, people abroad, have the surgeons abroad got that cover? I don't know. You'd have to check. But that it may not be that they've got the cover. That might be a reason why it's cheaper. It might be that the hospital hasn't got such stringent criteria they have to follow and meet, guidelines they have to meet in terms of their clinical governance and all the sort of running of the facilities. So the problem that is, and one of the issues I make in the book, is not that going abroad for surgery is bad, or at least not that surgeons abroad are bad, because obviously there's lots of good surgeons in every country, just like there's good surgeons in Birmingham, there's good surgeons in Belfast. If you live in Belfast, you're probably better off with a Belfast one. You can come to the Birmingham one, but there's lots of good surgeons everywhere. The problem with the ones abroad is you don't know the level of qualifications, you don't know the level of training, because it's different in every country, and you don't know what the qualifications are, what the training are, what the governing bodies are, who you can go to if you have a problem, because they'll be governed by that country. You can't go to the GMC, you can't go to the General Medical Council or BARPS or BAPRAS, the Plastic Surgery Associations here, and complain about a surgeon over there. You can only complain about surgeons who are members of those associations. So yeah, I'm totally with you. I'm not. Yeah, Angela, you're absolutely right. You're absolutely right. People, it does make sense to people go local, but I understand why people do go abroad. So yeah, you can come to see me from Belfast. Please do. Well, if you want to, you can, and I'll be very happy to see if I can help, and I'll do a Skype consultation. But my advice would be, if you're having something like a tummy tuck, which is quite a big operation, there'll be lots of good plastic surgeons in Belfast. So I would advise you to probably have a look at those first. And if you get no luck or whatever, if you want any advice from me, then or anyone else at the clinic, you can always get in touch with us. We'd be very happy to help you.